All right, welcome back to the broadcast. Last laps, we discussed reproductive health in women. We'll be looking at, some of the problems that come along, and how we can get to avoid them or prevent them, because prevention is better than cure, as they would say. And of course, later on, we also discuss the treatment, but what's important is the aspect of prevention of the same. And a renowned gynecologist joins us for this conversation, Dr. Ignatius Kibe. And I'll go straight to it. Dr. Thank you so much for always creating time to speak to us, speak to our girls out there on these matters that are very crucial and important.
It's always my pleasure.
Always a pleasure.
I would like to speak to boys also.
Oh yes, that's what I wanted to say.
And all of
us. You know what happened last week? We had a conversation here on matters, violence at the home setup, and somebody called and asked, what do you do, or how do you deal, with violence that crops up, because of infertility? That was a man who called, and for a moment we were all dumbfounded. Because
absolutely, because it's all scientific, and probably is a good point to start, because a lot of infertility in this country and the world over, but more in Kenya, is due to blocked fallopian tubes.
Okay.
And people have not come to terms with they think blocked fallopian tubes are a condition that one is born with. No, it is due to infections. It's due to sexually transmitted infections, STIs, and even when you talk about ectopic pregnancies, they are due quite often due to infections. Most of them sexually transmitted. So it's a good point to start. Now I'm at your exposure. It's always my pleasure. If I'm useful to Kenyans and to the world, it's my pleasure.
It's true. And the very basic point, every time we're talking matters health, we start from the aspect of definition.
Yes. And now, sexually transmitted diseases are those diseases that, like the word says, are transmitted
sexually.
Sambaza.
All right.
Sexually, either penetrative sex, or sometimes, and it's becoming very common to have people who are doing anal sex. And there is also the oral sex. And sometimes there may not be penetrative sex at all, but probably a contact. People are doing foreplay or smooching, and sometimes the private parts, the so-called private parts, I don't know why they are called private parts.
No, it's because sometimes, at a time like this, there's watershed period, and therefore we call them that, so that at least we do not go against the
private parts.
Yes.
All the intimate parts. So when some diseases like the virus, like herpes, can even be transmitted when body parts come into contact, not necessarily penetrative sex.
Okay.
So any disease that will be transmitted due to sex of any type, and I want to warn people about the increasing incidence of anal sex or homosexuality. It increases STDs, sexually transmitted diseases, many times fold.
Okay.
So that's the definition. Probably I could mention some of them, some of the commonest.
Yes, causes of this.
And people imagine like they don't exist, like these diseases belong to a certain section of society. It is not true. People imagine that probably in magonjwa ya mahaba, women who do commercial sex work, not necessarily. It is there even in the so-called domestic places, in the married couples' lives. And I'll mention, and then we can go into little detail.
Yeah.
I can do maximum, the ones that we see in a good setup could be as many as 20. Let me probably mention a dozen that are very, very important. Number one is a very common one, gonorrhea. Very, very common, from Neisseria gonorrhea, old disease. We exported malaria to Europe. We imported gonorrhea and syphilis.
Okay.
So gonorrhea is that condition where the private parts, the so-called intimate parts, start to ooze purulent discharge, you know. It's like glue, and it could slightly be whitish, curdled milk-like, and it can be both in men and in women. It's worse, of course, in women because of their geography, the anatomy and the physiology of a woman. You know, short urethra, wider sexual organ. Gonorrhea is a very serious, and these days, by the way, there is a new gonorrhea, shall I call it? It's called highly resistant, drug-resistant gonorrhea.
Okay.
And we have realized that it's very common, especially at our coast, slowly coming to upcountry, to Nairobi and then Kisumu. And it is very bad. To treat one case of highly drug-resistant gonorrhea, we were spending 1.5 million shillings.
Oh, yeah?
Million shillings for gonorrhea. And it is terribly resistant. It's giving physicians and doctors a hard time. The second one, like I mentioned, is syphilis.
Right.
It's a Treponema pallidum infection. The scientific name is Treponema pallidum. And it's a sperachoate, is a bacterial infection. Initially appears like a painless papule or small pimple, or if you want to call it, or hardened like a small wound in the genital area, both in men and in women. That is syphilis. Sooner, probably after 2-3 weeks, noticing it, it's not painful.
Okay.
And but the person can transmit. After 3 weeks, it just disappears. Some
Okay,
people
and then you assume
earlier.
that it's not there.
And you assume I'm cured of my pimple, they
All
call
right,
it.
all right.
Kumbe, it has gone to what we call the secondary stage,
Right.
where it now multiplies in blood and continues to infect other tissues. Syphilis can remain in the body for as long as 30 years
Okay.
untreated. And it's also stubborn, you know, it's very difficult to treat syphilis. I would want to urge, because I know some doctors, nurses, pharmacists are watching us. I would like to urge that we do tests, and not the ordinary, the old style VDRLs and the cans. I'm now addressing doctors. We could also do a TPHA test. We call it Treponema pallidum hemagglutination test, TPHA test, which now will identify the syphilis in a person who has no symptoms. In about 10 to 15 years, it goes to tertiary stage.
Wow.
In tertiary stage, it can do anything. The body can get wounds, and it can get all over the body lacerations, diseases, even underneath the feet. You know, you get somebody getting very many small wounds on the body. And it is very bad at that stage, because it can even go into the central nervous system, to the spinal cord and to the brain, and somebody becomes mad.
Okay.
This is syphilis in the tertiary stage, and it's very difficult, absolutely difficult to have it treated. So these are the two commonest and most mentioned diseases. The third one, which to me, at personal level, is worse than the first two, is chlamydia trachomatis. Chlamydia is responsible in Kenya for making very many women infertile. Chlamydia doesn't have signs and symptoms. They are not drastic. Occasionally, somebody could notice a fluidish discharge coming from the private parts. It sometimes looks innocent. And there is confusion between discharge, PV discharge, vaginal discharge, of a lady with chlamydia and probably the ordinary cervical, normal, so-called normal discharge. So chlamydia is terrible. It quickly causes inflammation. Inflammation is like somebody has burnt the whole system. You know, the apparatus of reproduction. They quickly become inflamed, and there are small wounds all along, and more particularly wounds in the fallopian tubes.
Okay.
And once the wounds develop in the fallopian tubes due to chlamydia. And this tube, people imagine, is like mfereji ya maji. Hapana, is very thin. It's like the inside of a biro pen. It's very, very thin. Okay. So when there is a small wound on one side, it blocks. It touches the other side and it blocks. Okay. So most of the ectopic pregnancies and most of the blocked fallopian tubes and salpingitis, sometimes you hear that at the terminal end of the fallopian tube there is fluid correction, and the person, the egg just cannot go past, and the sperm cell cannot go down. Then they have blocked fallopian tubes due to chlamydia. It's a terrible thing. And chlamydia is the same thing that makes, like in some communities, you find there is a lot of eye infection. In fact, the word trachomitis is from trachoma. And you find in the mornings, here, at the corners of eyes, there is pus like discharge. If that pus goes down there, and it quite often does, then there is trouble. It's chlamydia trachomitis. Okay. The fourth common one, very common, is herpes. Herpes genitalia. And this is a virus, herpes hominis. And there are two types of if you see somebody, by the way, who keeps on getting what we call homa kubwa. Okay. Ati akona inflammation, akona to pimples on the lips. That is herpes. And we can get that as, we call it HSV1. And the other one is HSV2. Ukimwona na hizo, quite often, akona zingine kule. So when somebody has this inflammation on the lips, he should know that he is HSV1, and HSV2 is genitalia. And here you get again inflammations. You get small, if you want to call it, pimples that have little fluid. This fluid is like clear fluid. Okay. It is there in the labia, the external genitalia. It is there in the lower part, the commissure, and between the back part where we do the long call and the front part. Okay. It comes there. It comes to the lips. Sometimes it can even be on the pubis, mahali iko nywele. Sometimes it can be even up in the makwapa.
For how long would one be having this? If probably
goes for 2-3 days and then disappears. That is the lie.
All right.
You know, it comes, it flares up. Within 4 days, somebody says nimepona. No. Hujapona, imejificha. It can, in fact, herpes can become chronic, permanent in the body, unless you get a very good doctor who can clean it up by repeated antiviral treatment.
Okay.
And like I said, it can be forever. You know, it stays in. We call it. It is repetitive. We say this herpes is chronic. It keeps flaring up. We say it is a very dangerous disease. Sometimes we get herpes in children.
And I wanted to ask that, how would we even imagine that this is probably transmitted?
No, it is a very interesting virus, because sometimes small children between age 1 and probably 10, they get this, the upper lip, and sometimes mouth ulcers that are hyperinoidal, herpes. And so it is a universal disease. Okay. It gets anybody and everybody. But after some time, I don't know, God gives remission. They started as 1,000, and towards the end, only 10 or 20 people keep getting this repeated herpes, chronic herpes infections and exacerbations in the mouth and in the genitals.
Long-term effects are the same.
Oh yes, because it is forming wounds. You see, when those when those blisters and the small wounds and the small we call them vesicles, when they break up, they form wounds. And if it was forming wounds inside in the fallopian tube again, or in the private parts, First of all, the lady will not enjoy sex. The man will not enjoy sex. In men, especially men who have been circumcised, you find it gets around the scar of circumcision. And they're small, watery papules, vesicles, very itchy, and sometimes very painful.
Okay.
Sometimes this herpes can develop into what we call a herpes zoster. That is a huge, big problem where you get inflammation on the whole one side of the face, or the bust, the breasts and the chest. Sometimes you get herpes on the buttocks, and sometimes you get herpes in the thighs, the inner side of the thigh, and it can be very, very painful. That is herpes, and it's a very common sexually transmitted disease. When it is not flaring up, when it is dormant, it may not be as infectious as when it has flared up. Now, another common ailment, very common, is what we call Trichomonas vaginalis and the protozoans. This Trichomonas vaginalis is unique because it's all over, you know. Sometimes with very little infection, you get this lady getting discharge, which is curdled, sometimes even greenish, you know, and it soils the underpants. And you find the underpants become bleached, or they get dirty, and she is ashamed of it. The telltale story is that in Trichomonas vaginalis, in Trich and Gardnerella, we call them flagellate bacteria. It smells like rotten fish. So the lady will be moving around, and she knows that she's smelling. So sometimes you find a lady who doesn't want to wake up from her seat, or if she does, if a lady just raises her leg like this,
everyone disappears. Hold it, Dr. The causes, you know, how then would you prevent such? Because I mean, there are occurrences where one would tell you that, you know what, I've not had intercourse, and therefore they don't understand why they.
Some infections are in the environment. Like even the one that I was going to mention next, Staphylococcus, and even Streptococcus infections. Sometimes are in the soil, sometimes in water, sometimes. Look at it. Even using the same towels, the same toiletries, the same sundries in the bathroom, you can get these infections. Like I mentioned, and the next one, because we have now not followed the whole list, is Candida. Sometimes from the environment, you find them, a girl like you, and you are in a skirt, a beautiful skirt, by the way. I'm impressed. I'm happy with you.
Thank you.
This is very good.
Thank you.
And you are standing there, sometimes sweeping your house, or you're waiting for your mat to go home, or you're near your car, and dust goes in with Trichomonas vaginalis. Dust goes in with the Candida.
Are you telling us to stick to trousers? Somehow.
Well,
hold it right
somebody there. In trousers is much better protected. But bacteria.
Before you tell us the bad, Dr. allow us to take a quick break.
Anytime.
Thank you. And then we come back with more on that.
Okay.
Welcome back to the broadcast. Thank you so much for the feedback that is coming in. Of course, if time allows, we'll sample some of them as we proceed with the broadcast. Stay with me, Dr. Ignatius Kibe, as we expound some more on the aspect of, the reproductive systems, the things that would probably cause us trouble in, siring, and, some of the solutions that we probably should invent or should be having or are already invented to get us to a point where we can all, have a setup of family setup that is complete, because that is technically the desire of every other man and woman who come together as husband and wife.
Indeed, even the very I believe the creator, this one who made those private parts, you called them.
Yes,
I didn't.
You didn't.
It was for two things. One is pleasure, of course, an expression of love and intimacy, and the is more important one is procreation.
That's true.
So we were at a point where we were talking about,
I was asking whether we should be
wearing
focusing much on trousers as opposed to dress.
So long as these trousers, there is a caution there. So long as these trousers, you don't overdo them. Some of you are wearing very tight jeans.
Okay.
So much so tight, I don't know even how they are pulled up. I don't know whether they apply mafuta or and how they even remove them.
What's important is that they are up and they are down.
And if they could be a little bit loose, because we want air. Some of the infections, some of the discharge are encouraged by this tight and very rough jeans. Jeans were intended for miners, underground miners.
All right.
But it became a fashion. They made a fashion out of it. And a gracious lady, surely, if you can wear trousers, why not? It's good for even healthy. But when it is very tight jeans, the pencil and the bullet and I know them.
Yes.
And the carrots. They can even bring
Don't go so hard on us, though. Yes.
So some of the problems are made worse by the dressing code itself. So I was at that point where I said you can pick some of these infections like Staphylococcus, even E. coli. I want to mention the other one. The seventh one is E. coli. Escherichia coli is a notorious, very common these days, probably in women who feel smelly or who smell bad in their intimate parts. It is due to E. coli. Escherichia coli is common, and it is a normal bacterium in the digestive system, in the anus. It is normal. But now, what are women doing? And take note of this.
Okay.
Women are wearing tissue paper to wipe their urine. I don't know where the thread came from. I don't know whether you men are telling women that they are smelling urine. So they are picking tissue. You know what is in tissue paper? Number one is recycled paper. Where do they pick it from? Sometimes the papers, the trash being outside the maternity where there are, placentas, where there are fetuses, where there are blood clots, even the ones that recycle from hotels. What is inside that paper, that trash basket? Somebody probably vomited. Somebody probably threw her pads.
So what are we supposed to do, Dr.
What were our grandmothers doing? And they were getting as many as 10 children, and they were not getting these STDs. Escherichia coli moves from the backside. And now it's very difficult to use this tissue paper backwards. And you've been told repeatedly, even when women go for antenatal clinic and the postnatal clinic, you are told wipe a girl from the front to the back. But when you go to urinate, you are using from the back to the front. You are carrying germs from the anal area and the commissure, the space between the anus and the lower part of the vagina, and you are bringing the whole thing up. And you are bringing Escherichia coli.
Okay.
So you realize very many of our women are smelly because of, and the E. coli can
what
also.
What were they doing? Let's go back there.
They were not doing nothing. Mama, those people were just doing their thing and then touching the front and walking away. I mean, they were hitting it and walking away. When did you first notice tissue paper? You are a young generation, but this is a new phenomenon. It's not used anywhere in the world. It's only Africans who said they are smelling. Did your boyfriend or your husband ever tell you are smelling? No.
Sometimes you don't have to be told.
We even like it ourselves. Yeah. Now that is the African style. We say that smell is mine. You see?
Okay.
But when you apply now tissue paper, which has been recycled, and nobody can actually disinfect vomiters. Nobody can disinfect the blood clots that were next to this tissue paper before it became tissue paper. They only go and bleach it, and you are using it here sometimes for hours on end. So it's very dangerous. It's very bad, because you get a UTI, a urinary tract infection, which and the V and the urinary vault are neighbors, next door neighbors. So sooner than later, the bacteria move from urinary tract infection to the lower side, which is the genital. And the man of the home comes and carries it further inside. And it becomes an STD, E. coli. Along with E. coli, we mentioned Staphylococcus, which is very stubborn. Staphylococcus, sometimes we treat Staphylococcus 10 times, it doesn't go. It just doesn't go. We are ending up using very, very powerful antibiotics, which we use as reserve, like vancomycin, because the ordinary antibiotic cannot deal with the Kenyan Staph aureus. It is terrible. It's very bad. Of course, now the worst STD, sexually transmitted disease, is HIV. And HIV is a virus. Up to now, it has been taken probably by COVID-19, but it is a killer.
It is.
And you shouldn't be cheated that HIV has gone. No, it's only that people talk about ati alikufa kwa kifua kikuu, he died because of TB, he died because of this and that, but it is essentially the generic, the origin, the etiology of the problem is HIV. You should fear HIV. And when you see girls come to us telling us, I want to buy P2, it simply means she did it without protection. And protection is one of the best, methods. African men don't want protection. Some of them even start with the protection, with the CD, and throw it in between. They remove it and throw it away. So HIV is an STD. It's a terrible STD. It's a killer STD. Next to it is HPV, human papilloma virus. Causes cancer of the cervix. Causes warts. Those small. Sometimes you get warts even on the legs. Sometimes on the teeth. I beg your pardon, on the tongue. Sometimes you get warts in the buttocks. You get warts. Warts are terrible. Verruca vulgaris, they are very bad, and both there are in fact 3, it's not just 2. HIV, HPV, and Verruca warts, all of them can predispose cancers. Not just the cancer of the cervix, but also other cancers. We have gotten cancers of the whole system, the whole apparatus of reproduction. We've got cancers from HPV that are in the ovaries. So girls, be very careful with viruses.
As we are careful, Dr. Sometimes there are some of these things that are introduced to us, like you rightfully put it. The tissue paper just came in the other day, and we've embraced it hugely. I don't know whether you are social media person, and whether you were privy to the kiberiti or the matchbox analogy. Have you heard of that?
Yes, I'm only older on the body, but in the brain.
Okay.
I'm
Let's learn from you on this one.
It is terrible, you know. Let me put it this way. Let us generalize it. Let us say this this phenomenon, and it's thrown to Africa, whereas where it comes from, they don't do it.
Okay.
China, India, the so-called Far East, and even Europe and Americas. Anything that goes there, especially for women, even if it is a V-gel, even if it is locally, our girls are even using ndimo, lemon. So sometimes they want to spray and smell nice when they are having a date. You are destroying yourself, my friend. Don't put anything there, I repeat. Please. That organ is self-washing. Ordinary soap, the one used for bath, and plenty of water, and don't scrub it. There is a protective layer, we call it the epithelium. We say the epithelium is those layer of cells that protect the V. And that place all the way in to the uterus and the fallopian tubes has a mucus that protects it and has a pH. pH is acid-base balance. If you spoil that pH because you applied a cream, especially creams that have steroids, anything with a B, something B, Kibe B, B, Candida B.
Candida B.
No, don't mention it. That's somebody's
okay, that's somebody's somebody's brand.
When you call it Candida B, that B is very dangerous.
Okay.
That is betamethasone. H is hydrocortisone. It works like a miracle. You apply it on your face and you brighten up, and you, I don't know who told you that the browner a girl is, the more beautiful. In the contrary, black is beautiful. We are telling you, don't use steroids. Doctors, be very careful when you prescribe something with betamethasone, hydrocortisone, beclomethasone, those steroids, corticosteroids, 17-pentanophenanthrene ring, nucleus steroids. Don't. You are spoiling our girls' private parts, because initially the so-called pimples will seem to disappear. Sometimes overnight is like a miracle. Only for it is hibernating, and that B goes to the kidney and spoils the kidney. Okay. Goes and makes the person get kidney failure, get diabetes. So the side effects of B's are very many. So don't spoil your some girls, leader. Some girls are placing fruits, even avocado, ripe avocado. Somebody comes and tells them, weka your avocado.
Itakuwa safi.
Itatereza.
Okay.
Wait. You spoil the...
Asubuhi.
you spoil... That's why I was kind to use the Swahili word. But please, let it wash itself.
Right.
Little water, ordinary soap, kawaida soap, and don't over scrub. Yeah. Some women are picking even pieces of gunia, the pieces of, and they're putting inside, and they wanted to, imagining that even the smell will go because of overwashing. You overwash,
and then it becomes worse.
And it becomes worse because you've destroyed the protective layer. So we were at HIV.
But that time is not on our side, but I'm glad at least you've touched on some of the prevention mechanisms. We have a phone call. Mary from Kitale is here. She probably has a question, or maybe would want to weigh in into this. Mary, how are you? Mary, how are you? Mary from Kitale, we're listening to you. I'm not able to hear Mary.
Double Mary.
Yes, double Mary, because Mary is my producer, so I'm telling Mary that I'm not able to hear Mary. Hello, Mary. Can we have the volume, please? We've lost her. I hope she calls back again.
Yeah.
Yes.
So I wanted to go slightly more on Candida, because every other girl is going over the counter and saying, give me those tablets for cleaning there.
Yes.
And we are ending up with the clotrimazole resistant fungal infections. Fungi, to an extent, every other woman has a fungi. And that's why I said, some of these discharges should not be, you don't call the chief or the minister for defense when small things happen,
yes.
And you men, don't also go to your ladies when they tell you I have a discharge. It's like she has murdered somebody.
Someone, yeah.
No, discharges are common, ni kawaida. Some of them are absolutely innocent. And you men, I'm looking at you on the face and telling you, when your wife or your girlfriend brings you tablets and capsules and a cream and tells you these were prescribed by my doctor when he realized that I have a dangerous bacteria or virus or fungi, don't jump at her. Hey, where you are always going out. No, I said sometimes even in the dust, sometimes in the water, sometimes, and this is very important, sometimes where you hang your underpants, and there is dust, and the dust is carrying staphylococcus, is carrying Candida. And so let there be peace. Let us understand one another. I like men who accompany their wives to my clinic when they are not fighting and they listen to us. And you doctors, please, don't brand everything is out of sex. And the man says, but I've not been going out. Where did you get it from? No. It is possible, and we said it can be universal. Herpes can be universal. Nanividoda. Woods in there.
All right, Mary is back.
Oh, Mary.
Can we listen to her? Mary, how are you? Mary Jumbo.
Yes, hello.
Hello, how are you? Dr. is here listening to you, and so am I.
Good. Can I hear you? Yeah, I'm good.
The line is not clear, Mary.
Hello.
Yes, hello.
All ears.
My question is, last weekend we went to hospital.
Listen for me, because
I might need the help of my producer. If she can hear that well, maybe she could tell us the question, because I can hear it well too. Mary, could you please help us hear that? It's not clear. Well, once we are able to get a hold of her, I hope we can call her back so that we can get her question and respond. Yes?
True. So there is, like I said from the outset, we've already mentioned 10 different diseases.
Yeah.
Now, there is one thing I want to tell ladies, men, and doctors. In Kenya, quite often we are getting a mixture of these infections.
All right.
We're getting the fungi, the Candida, mixed with sometimes Trichomonas vaginalis, mixed with sometimes Chlamydia trachomatis. So it is very bad for a patient, a lady, to go over the counter, and I'm pointing at you pharmacists. Chapter 244 Kenya law stops you from selling those things over the counter. Ati nipe amoxicillin 10, nipe, no, don't. What are you treating?
Okay.
You don't know. Until we go to a lab, we do wet preparation, what we call gram stain, followed probably by culture and sensitivity, because we are forming very many resistant diseases that will never cure. Even the lady will keep getting repeated.
I understand, because most of the times, there are times we've gotten to a point where we can prescribe this for ourselves, because you've gone to the doctor, they prescribed it the first time and it seemed to have worked, and therefore, you know, when this problem arises again, then I'll go back and get the same thing now via the counter.
Now that is a problem, because it didn't work
okay, in the first place.
That's why it is recurring.
All right.
Sometimes probably somebody had also herpes mixed with, like we said, chlamydia trachomatis, and you cannot even separate the two until you go to a lab, until you take blood and do HSV1, HSV2 for herpes, and then you take this, like that one, chlamydia, that I said is very dangerous, is causing a lot of infertility in women, a lot of what we call ectopic pregnancies. Until you identify it in a lab,
there's no way.
You don't know what you are treating. Why give those tablets? The pessaries. What are you treating? That's the big issue. Even in an ordinary garden, there are very many different types of weeds. What kills couch grass may not be the one that will kill Mexican marigolds. So let us do proper diagnosis. If she has taken 3 weeks, another 3 days, 72 hours of a culture and sensitivity, and to complete it, to finish it completely, this is much better than doing shooting in the dark, hoping that this, and most of these girls, very unfortunately, are in the childbearing age,
and therefore
will become infertile.
Hold it right there, Dr. Lots of questions coming on board. Time is not on our side. Can we commit to a phase 2 of the same? Of this conversation?
I'm always ready and willing. I'm a pro-life doctor. I like when people reproduce, and not just reproduce, enjoy themselves
as they
in the inner room.
Okay, well, there you go. And we keep these questions for next time. I hope we can get a hold of you sometimes next week so that we can continue with this, preferably the very same day. And yes, I'm just trying to lock you to a point where you cannot say no to us. So make sure that you make it a date.
Promising the audience.
Yes, you better promise them that Monday we continue with this, as we probably get to answer some of the questions.
Ready and willing, and we want more questions, clearer questions, and even case studies.
Yes, that's right. We close it at that, as we look forward to that session.
Thank you very much. Thank you, viewers.
Kibe, thank you so much for your time, and thank you so much for the feedback. We close it at that, as I look forward to see you again tomorrow, and looking forward to that session on Monday also, as we get to answer some of your questions.